Download our app available from the App Store and Play Store.
Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan. Let's look at today's daily bulletin. Doctors have expressed their concern over the huge number of vacant postgraduate medical seats belonging to clinical specialities. Taking up this issue, the doctors under the umbrella of Federation of All India Medical Association recently approached the Union Ministry of Health and Family Welfare. Pointing out that more than 300 clinical seats are lying vacant, the doctors have demanded to conduct one special round of NEET PG counselling on immediate basis. The Karnataka High Court has ordered the Department of Youth Services and Sports to revise the ranking list involving 18-year-old Aditi Dinesh Rao and 3 other individuals regarding their eligibility for admission to undergraduate medical programs under the sports quota and submit it to the Karnataka Examinations Authority. The Bombay High Court has observed that health service is a sector where the doctors are required to treat the patients many a times on emergency basis, and many of cases are of such nature that they brook no delay, and in such contingencies, if the treating doctors are required to face shortage of medicines or medical equipments or both, one can imagine the fate of patients in need of emergency treatment. The Delhi High Court on Tuesday sought the stand of the centre and the Delhi government on a petition by the Association of Practicing Pathologists seeking action against health service aggregators over allegedly misleading advertisements, ridiculous discounts and unsolicited messages.
Primary care visits rise sharply in the weeks immediately preceding a sudden cardiac arrest, according to results from the ESCAPE-NET project. Sudden cardiac arrest causes 1 in 5 deaths in industrialized countries. Most sudden cardiac arrests occur in the community in people not known to be at risk. A cardiac arrhythmia called ventricular fibrillation causes the heart to stop pumping and blood flow ceases. If blood flow is not restored quickly, the individual passes out and dies within 10 to 20 minutes. New research published in Developmental Medicine and Child Neurology has revealed a link between maternal diabetes during pregnancy and a range of neurodevelopmental conditions in children, including autism, ADHD, which is attention deficit hyperactivity disorder, developmental delay, intellectual disability, cerebral palsy, and epilepsy. The retrospective study included 877,233 children born between 2004 and 2008 in Taiwan, whose mothers had type 1, type 2 or gestational diabetes during pregnancy. The effect of type 1 diabetes on neurodevelopmental disorders was the largest, followed by type 2 diabetes and then gestational diabetes. Acupuncture is a form of complementary therapy that involves inserting very thin needles into the body. Practitioners insert needles at different locations and depths to treat different health issues. Acupressure, on the other hand, is often thought of as simply acupuncture without needles. Both acupuncture, which is invasive and involves inserted needles, and acupressure, which is non-invasive and involves mechanical pressure, can potentially help reduce sleep disturbance in patients with cancer. A recent analysis of published clinical trials suggests that acupressure may have a greater effect than acupuncture. Drinking 2 or more cups of coffee a day may double the risk of death from cardiovascular disease among people with severe high blood pressure, but not people with high blood pressure not considered severe, according to research published in the Journal of the American Heart Association. In contrast, the study found that 1 cup of coffee and daily green tea consumption did not increase the risk of death related to cardiovascular disease at any blood pressure measurement, though both drinks contain caffeine. According to the FDA, an 8-ounce cup of green or black tea has 30 to 50 mg of caffeine, and an 8-ounce cup of coffee has closer to 80 to 100 mgs. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.